Hawaii is on lockdown and essentially closed to visitors for at least a month to slow or even stop the spread of the deadly coronavirus. But questions remain. What have we learned about this disease? How long is someone contagious? How secure is our supply line for food and other products? How are we protecting our elderly residents? What options exist for parents whose kids are not in school because of COVID-19? Tonight's live broadcast and live stream of insights on PBS Hawaii start now.
Aloha, and welcome to Insights on PBS Hawaii. I'm Daryl Huff. We are dedicating all of our Insights programs in April and possibly May to COVID-19. We're postponing indefinitely our previously scheduled topics. There is so much to talk about that each week we are inviting experts in different areas who can provide expertise, guidance, and insights to this ongoing conversation. We have adjusted our set again to provide even more social distancing between me and our guests and the guests themselves, and we'll be using online conferencing tools in future shows. We look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll find a live stream of this program at pbshawaii.org and the PBS Hawaii Facebook page. Now to our guests. Lauren Zerbel is the Executive Director of the Hawaii Food Industry Association, who can address concerns about the food supply chain in our state. Seiji Yamada is a family practice physician with a master's degree in public health that focuses on international health. He is also experienced in disaster management. Patricia Blanchette is a medical doctor and the founding chair of geriatric medicine at the UH Medical School. She develops public health strategies for the elderly population and nursing home management, and she's involved in a lot of other stuff that I just heard about. We'll talk about that too. And Colleen Momohara is from the State Executive Office on Early Learning with advice and activities for parents for the youngest members of our community. Let me start by going around the table a little bit. You know, it's hard to understand or comprehend how big a change in our lives we are going through right now. Let me start with you, Lauren Zerbel, not talking so much about your job, but what's this been like for you, your family, and your work?
Big changes for us. My son used to go to St. Anthony's School, and they closed down when the public schools did, so he's been at home. Well, I've been working at home doing several conference calls a day. My husband is active duty in the U.S. Navy, but had actually planned to get out and fly for Hawaiian Airlines, and that's was already hired. That's not happening now. Obviously, there's they're in a really difficult position. So, it's been challenging. His squadron has sort of started to finally allow them to work from home a little bit. So he's working from home now a little bit, and it's been very chaotic, yeah.
And then as far as your clientele, the food industry, obviously they're going through some really rough times too.
Yeah, so it's been sort of phases. The first phase was a lot of hoarding and panic buying, and you saw empty shelves and a lot of rumors going around that were untrue about the ports closing, which impacted sales really dramatically. And now we're kind of looking to see in the next week or two what the new normal will look like, and it does look like it's not good for business. And we think it's a combination of several factors. One of the major ones is the decline of tourism, and the impact that's going to have on the food industry will be very dramatic. We used to, the Star Advertiser printed, we had 240,000 people here at any given time who are tourists, and those people are not going to be there. So that's a pretty big drop in volume for really any business.
Dr. Yamada, tell me about how's it going with your practice? How has this affected your practice and your life itself?
So we're definitely trying to head more towards telephone visits and telehealth visits via video teleconferencing. But I am in a setting where we are still seeing some patients face to face and trying to be as careful as possible. But given what we know about asymptomatic people with the infection and their ability to transmit the infection, it does make all of us a little afraid.
You were saying earlier that it's hard to deal with patients who are anxious when you have your own level of anxiety.
Indeed. I suppose we try not to project our anxiety upon our patients.
Dr. Blanchette, First, a little bit about your life, how it's been affected by this. Are you able to work from home? You've got so many hats to wear.
I'm doing mainly working from home now. We live in a 3-generation household. My husband and I, our son, his wife, and their 3 children. And things have changed quite a bit. The oldest of the grandchildren was off at college this year, her first year. She's now home and doing some online studies that her college set up. And she runs track, so she hasn't been able to run track. So she's got all kinds of exercises and whatnot that she's doing. My son is a school teacher, and he's doing online teaching from home. So that's been quite interesting.
You're seeing the whole range of effect on people within your own household, but also in your role as a medical director for a number of nursing homes. What's been the most dramatic effect on them so far?
Well, my main work has been as Associate Dean for Clinical Affairs for the medical school and the Chief Medical Officer for the medical school's faculty practice plan, University Health Partners. And as one of the services that we provide in UHP, University Health Partners, is what we call the Teaching Nursing Home program. Department of Geriatric Medicine, in an effort to fill a need in Hawaii for good doctors to go to nursing homes, does a good bit of its teaching now in clinical care in that practice, where we teach fellows in geriatric medicine, residents, and students who rotate with the faculty. And so not only am I involved with the management as a medical director of several nursing homes, but also in setting up and managing and assisting in the teaching program that we do. Our faculty practice has always focused on trying to fill needs for medical care in Hawaii, and that's just one of them that we do.
And right now, there's so much need in the medical community, but also, if you wouldn't mind telling me a little bit more about what's happened in the nursing homes now that they can't have their families with them.
That's been particularly difficult. I was in touch with several doctors who were nursing home doctors in the state of Washington a couple of months ago. And we could see this coming, and we didn't know exactly what to do, but we could see it coming. And so I had a strong sense that we needed to quarantine our nursing homes, and sooner rather than later. And so I was one of the people. I talked to our administrators, and I said, we have to do this, knowing full well how difficult it was going to be. One of the things, there's a myth in aging that we abandon our older people. Well, I can tell you our nursing home patients are anything but abandoned. Families are very, very frequently in the facility to come in with, they come in to care for their parent, they come in to help feed, to help set up the meal, to provide them company during the meal. And this has been very difficult to close that down.
But I mean, there must be some satisfaction in knowing that as this plays out, that will probably save some lives.
Well, I hope so. But it's been tough. But we've set up all kinds of things, telephone visits, iPad visits, and the nurses have been fantastic about calling families and letting them know how their loved one is doing.
That's really good. And Colleen Wawahara is a longtime teacher and involved in early learning. Your own experience with your family and what's going on in your field around this, are people kind of freaking out that they've got kids at home with nothing to do?
So for myself, my children are older now and on their own, teachers and a genetic counselor and one in the financial field as well, and so
Are they worried about you? Are they still telling you?
No, I think they think we're fine, and my mother lives with us as well, and so it's been a change. I think like for everyone, and I think personally for me is just trying to work from home is a very challenging situation to be in, as we're so used to being with people and working alongside people, some wonderful teachers and many wonderful professionals who are in the field of early childhood. And I think one of the things that probably we tend to hear more about are, children at home, and folks trying to figure out how to be teachers with their children. And what we know is that children need parents, and they need their parents to be with them, and that no one can replace parents and caregivers, whether it's grandparents. And so the whole idea of supporting children by being parents first and doing the things that we typically do in our daily lives and really enriching family life as we redefine what family feels like.
Are parents generally pretty good teachers? Or do they underestimate themselves as teachers?
I think many parents, I think we bring so many natural things in what we do with kids, and we may not realize the impact we have in terms of the way we actually contribute to children's abilities to learn, their learning competencies. And we actually do many things when we play with them, when we interact with them, when we do things with them, like just typical things around the household of preparing meals together, or sitting down and reading with them, or just being there present with them and inquiring about what they're thinking. It does so much about making kids feel that they matter, but it also really does help with what we know in the field as executive function and self-regulation, where they really do need to be able to sort things out and manage being involved in some really key critical decision-making, reasoning, strategizing, problem-solving that we just don't realize how integral all of this is in what we do.
Lauren Zerbo, we had just an astounding series of events that affected the retail and food industry dramatically. You mentioned the hoarding, the lines. What was for you the most head-spinning moments of this outbreak?
Probably the result of the rumors about the docks closing and the panic that ensued, and how widespread that actually went. I had people in the food industry contacting me, is this true? No, but a lot of people believed it, and that really did cause quite a bit of panic.
There's also a lot of rumors about, there's a COVID in this place, there's a COVID in this place, and did you hear things like that? And also, there was a lot of confusion about who was being forced to close and so on. What was it like for your association, your members, when they were being told, you're essential, you're not essential, you're essential, you're not essential?
Most everyone who's a member of my organization is considered essential because they're all related to feeding people, or they're part of the supply chain. So a lot of our members are suppliers of water or other like alcoholic beverages or prepackaged foods, fresh. So pretty much the whole chain. And so it's been kind of surprising to see how this has impacted their volume over time.
Dr. Yamada, in your practice and in your experience, what's been the most frustrating thing for you as a doctor in this process? And I do have a question from someone, and I think this is just the beginning of what will be an avalanche of questions. My son is now waiting 6 days for the test results. My friend's mother-in-law has been waiting 7 days. Why is it taking so long? This is what we've heard from doctors too. Is that a big frustration of yours?
Sure. Obviously, testing is ramping up as the tests are actually being done on island now, but those that were sent out a couple of weeks ago took a good 9 to 10 days to come back because of the transport to the continent. And so getting people tested has been probably one of the greatest frustrations.
Did you have people you were trying to get tested and you couldn't get a result, or you couldn't get a test? What was the process that would happen?
Well, To some extent, we have been given a guidance about which patients to test, and of course, we want to keep an eye on the supplies, the test kits, the swabs, personal protective equipment that necessary to collect the samples, and of course, we need to prioritize the very ill patients, the hospitalized patients, and so they're first in line. But as I said earlier, because of the presence of people that are actually asymptomatic and infected, we won't know who is actually infected until we are able to test more widely. And my personal opinion is that even people that have relatively mild symptoms should be tested, meaning some cough, some fever, they should be tested because you really can't tell clinically who among those people are actually infected with a virus. And you can say everybody who has the sniffles or a little bit of fever should stay home, but there's a big difference between while you stay home and go to work and go back to work in a week versus you have SARS coronavirus 2, the virus that causes COVID-19, and saying, oh, now you need to be in a room by yourself with a door that closes, have your own bathroom, have food brought to you and left outside the door on a tray, and that's very difficult. Well, that's what you have to do if you really have COVID-19, and so that's very difficult to do, and for many people in most living situations.
And if they're not feeling that sick, they don't feel the urgency to do that and sacrifice so much, at all in the first place, right? I mean,
indeed,
disincentive.
There's folks that won't even go to obtain medical attention if they're not that sick. I think I have a bit of a cold. Maybe I can still go to work as a cashier at the grocery store. Maybe I can still go to work as a caregiver at the nursing home as a nursing assistant.
Doctor,
that's a big problem.
Dr. Blanchette, we were talking earlier about the quick progression that seems to be happening in terms of the testing technology. Do you agree that we need to be testing a lot more people to really get an idea of where this is?
I do, because we need to be able to control, and we can't do it very well unless we know who's carrying the virus and who isn't. One of the things that will happen in this disease is that we'll be able to contain it when we know who has it. And then we'll be able to emphasize the social distancing. Just in driving here today, we were very careful, and yet we were looking at people on both sides of the street standing in clusters without masks. And I know that it's hard for people this is something you can't see, something that you don't know about. There's a lot of people who feel invulnerable. This never happened to me. And I think once we have a better idea of where the virus is and what we need to emphasize, then we'll get a better handle on it.
Let me ask Lauren Zerbel, as an expecting mom and a mom, how do you deal with the distancing thing? Are you out and about much?
I know. This is the first time I've been out of my house in maybe 2 weeks. I do everything on Zoom. I do maybe 5 Zoom conference calls a day, and every national association has a daily update, and I get phone calls constantly, but I try not to leave the house just because I really don't want to get it because I'm pregnant.
Do your clients ask, or are they talking about, how they're supposed to manage their, I expressed my appreciation the other day to a young kid working in the supermarket. It's like,
yeah,
a stream of people going by, everybody's handing him, they got to scan everything. They're like, are you hearing a lot of fear from your members?
Yeah, so some have put up the sneeze guard separator, and there's a lot of,
Are there plenty of those around? I'm just curious. Is that one of the things that disappears immediately as soon as someone gets the idea?
yeah, well, I don't know exactly. I don't think there's necessarily a shortage of that like there are of surgical masks. But, you know, even I get contacted by people who are vendors of masks that want to sell them to grocery stores, and maybe that's the way things will end up going in the future. And I think we would really love to have the real-time testing at the stores and to be prioritized, obviously, behind healthcare providers, but we would like to have access to the real-time testing for all of our food industry employees.
What happens in a store when someone gets it?
They go home to quarantine, and, you know, we're disinfecting the stores, you know, almost constantly. So, you know, that has really taken up a lot of staff time to disinfect all the carts, all of the public surfaces. You know, and we have public education about, you know, don't touch something unless you're going to buy it. You know, keep your hands to yourself, keep a social distance, you know, bag your own groceries. Don't make the cashiers touch something you touched, and just kind of be mindful about those types of things when you're in the grocery store. And obviously, if you feel at all ill, please do not go to a grocery store or outside in general.
Yeah, I'm gonna throw this out because it's a fun conversation, but none of this conversation is fun. I take it back. Many people live in small apartments and have no yard or lanai for fresh air and exercise. It would seem that it would be safe to be in the park, to walk alone, if you stayed away from other people. Surfers are allowed to be in the ocean. It hardly seems fair to the rest of us. I think, do you think families are out there going stir crazy right now?
I think it varies. I'm sure if you're in tight quarters, it definitely would be more challenging, especially, and the younger the children are, of course. To be able to find ways within places that are like apartments, I think really have to start thinking about, you know, can I get to even just the lanai or the stairs, or, you know, a park is a really nice place to get to. But I think for young children, what's most helpful is to have things happening in that environment to some degree, right? I mean, because we can't go to as many places as we could before. So it's finding things to do at home with the things that you have, you know, whether it's creatively building and constructing with things that you, recyclables you have at home, or singing is a really great thing, singing and moving for young kids. I mean, emotionally it's very helpful, cognitively it's very stimulating, and these are things that maybe, you know, at least take the edge off of being contained in a space.
Let me ask, Doctor, is it important for people to get out and recreate in order to maintain their health, maintain their immune systems, or is it better just to hunker down? I mean, I think that's a very common question out here.
Well, I guess it probably varies from neighborhood to neighborhood, but and I think certainly in the urban core, it's harder to completely socially distance oneself while outside. But certainly if one can do some exercise within one's house, I think that's certainly helpful. But I think we have to pay attention to what people that are in conjoint living situations, and people in crowded settings, including places like homeless shelters. I think, you know, we have to think about our servicemen and women. Of course, we know about the case of the USS Theodore Roosevelt, where as of today, 114 sailors have tested positive. It's really not that different in terms of how close people are to each other than a cruise ship. And so, given that, I think we need to think about, say, like the upcoming Rim of the Pacific exercises. Do we want militaries from around the world coming to Hawaii to come on shore and participate in that? I think not. I think this is certainly not the time to conduct exercises of that sort. I think we do need to kind of work together to work more towards peace.
Dr. Blanchett, how worried are you about, well, let me ask this question first. We'll get into it later. I've got a question about people in nursing homes, but along those lines, there's a lot of kupuna that live in their homes and their families are in another house somewhere else. What's your advice in terms of whether you could go visit, bring the kids over just for a little while to see grandma, or bring her something to eat, or even, is that okay right now, or what do you think?
I don't think it's a good idea. Not unless we had absolute certain testing that was 100% accurate. Because while you may be bringing joy to that person that you're visiting, you may also be bringing something you don't want to bring with you, and that's COVID. So you don't want to do that. However, you have to think about your own family, your own environment, and to give some thought to how can you bring some interaction, some socialization, some fun to that relative of yours or older person that you know that you used to spend a lot of time with. Thank goodness for the telephone. Sometimes people have learned how to use FaceTime. That's great. The idea, though, of visiting with family members and then sharing what you may not know that you brought with you is just not a good idea. But give it some thought. How can you make that person's day better? We're doing that in the nursing homes where families are being very creative about staying in contact with their loved ones.
The question that I was going to mention is, what is the number of elderly in our nursing facilities, and what % are over 80 years old? This brings up this question, given your experience in talking with the nursing home folks in Seattle, what happened in some of those homes? Why did it catch fire there?
It seemed that they initially they thought it was the flu. It hit during flu season, and nursing homes are usually very well prepared to, first of all, there's a really big push to get everybody a flu shot. They're very careful about screening for symptoms because we know flu is very contagious. We're very careful to screen visitors when they come in during flu season. Sometimes we're more lucky about that than other times. But we're very conscious of flu and of isolation requirements for flu. I don't think anyone had any idea that what they were dealing with was not the flu initially and how contagious it really is. We now have data from other places that shows us that in a nursing home on the mainland where they had a small number of people who tested COVID positive, when they tested everybody else, the majority of the people were COVID positive, even though they weren't symptomatic. That's totally out of anyone's experience.
Yeah, and the result being that I heard Dr. Anderson, Dr. Bruce Anderson from the health department say something interesting on this show actually last week, interesting/scary. He said there's one of two ways we're going to beat this, end this. One is there's a vaccine. Number two is it runs through the entire population and we're immunized by contact with that disease. But Dr. Yamada, if you wouldn't mind commenting on this, or Dr. Blanchett, that would kill a lot of elderly people, wouldn't it? Or are we capable in this state of treating it even in the most elderly people?
So when we talk about the case fatality rate of a disease, it's not just the biology of the disease, it's how our medical system is capable of treating it. So we might actually end up with say a significant chunk of the population, 20% or 40 or 60% of the population, actually contracting SARS coronavirus 2 over the next year or so, or two. So that we can't have it all happen all at once, because then our healthcare systems will be overwhelmed. We don't have enough ICU beds for that. We don't have enough ventilator beds for that. So that's the whole point of a very familiar term now, of flattening the curve. Everybody, we want that peak to happen later. We want to happen peak not so high, with everybody getting sick all at once. And in order to do that, we have to have everybody be more mindful about social distancing, so they're not passing it back and forth amongst each other. And given that it can be spread by asymptomatic people or people before they develop symptoms, everybody has to sort of assume that you yourself have it, and that you have a responsibility to the rest of your community not to give it to others, and so therefore stay away from others as much as possible in this time when we're watching the epidemic curve climb day by day.
Dr. Blanchett, do you think that we here in Hawaii, I think there was a story in the newspaper by an epidemiologist who said, of all the places in the country, we probably have the best chance of flattening that curve. Do you feel that way?
The reason we have a good chance of flattening the curve is we got on top of this, not as quickly as we would have liked, but fairly quickly. The public health measures that were put into place by Governor Ige and Lieutenant Governor Josh Green have saved a lot of lives already. And so the other thing is we're an enclosed population. It must have been gut-wrenching for the governor to quarantine us, knowing what it would do to businesses, knowing what it would do to our way of life. But I think it saved a lot of lives already. And your question about should this just run through the population and then everybody's immune and then it's gone, that's too costly. It's too costly in terms of human life. And this isn't just a disease of old people, as we've now seen, even if that was not such a bad deal. You know, you're saving all the young ones and just the old people die. It's not a disease of old people, as we've seen. They have a higher mortality because there's other things wrong with them, and it's harder for them to fight off disease. So we have to continue the work. We have to continue the funding that goes into developing vaccines and testing those vaccines. And then when we do have it, and in a few years, begging people and insisting people that they get their vaccination.
Get their flu shot.
It's so frustrating to know that we can largely prevent flu and that influenza, and that we have to nearly insist that people get their flu shots. Maybe next year we won't have such a hard time getting people to take their flu shot.
Maybe this is a really hard lesson, right? Lauren Zerbel, a number of questions about conduct of folks in stores. Why are grocery store workers not required to wear personal protective equipment? Is it because of a shortage? Are you hearing your clients say, we'd like to give our workers masks, but there just aren't enough? I mean, they all got sold out of their own stores, right?
Yeah, it's a difficult issue, I think, on its face, because we know that the healthcare providers who are in the most need of the equipment have a shortage. So that's, I believe, why our government for a long time said that, you know, we should be saving those for the healthcare providers. And you know, I'm not really sure we're completely out of that yet. But we would like to have our grocery store workers wear personal protective equipment, and in many cases they are, especially now. So, I mean, maybe not the type of mask that you would wear in a hospital, but something to prevent you from touching your mouth and nose.
I mean, we talked about the food supply chain. Many of your clients are also involved in the other supplies, the sundries and so on, medical supplies. What's going on with that chain? I mean, does it feel like that's a genuine shortage that's going to take a long time to resolve? Or are you feeling confident that we're going to have new supplies, that there's going to be toilet paper back on the shelves, there will be masks, there will be hand sanitizers, alcohol? Or is that stuff coming down the pipeline, or are we going to see?
Oh yeah, people are being replenished regularly. It's just that it's on allocation. So there's a limited amount given to each store, and maybe it feels like there's a shortage, but really the shortage was caused by just a really aggressive hoarding at the beginning of this, and so on a national level, not just here. And so we're still trying to recover from that. So it looks like a shortage, but we are still being replenished, and everyone gets their allocation of it.
When you go shopping, do you go out and shopping, or have you been hiding from shopping?
I've been hiding from shopping. Fortunately, my husband has been doing the shopping since I'm working from home. But of the time that I had gone out, it's pretty empty.
It's kind of scary to go shopping.
It's a whole different feel, and it definitely changes the shopping experience.
You know, for either of the doctors, going shopping is like the only thing some people do, you know, that's really out in the public. Do you feel that people are too cavalier about the situation in the stores? That is, should we be very careful when we go, more careful than we are right now when we go shopping? Should we expect things of the stores, expect things of each other that'll keep us safe, that are not being practiced now?
Well, I think Lauren mentioned some of those measures that should be paid attention to by shoppers, yeah, but of course that depends on people being educated about touching things and not touching your face, and making sure that you're washing your hands, which is obviously hard to do when you're out and about, but carrying around some hand sanitizer, I think is certainly wise.
Doctor, do you feel like the retail environment is a place where people need to be more careful than they are right now?
Absolutely. I've heard stories of people going to stores and the stores were packed and people very close together. That's got to stop. But yet I've heard stories of people going shopping and only a certain number of people allowed in the store at any one time, and then everybody with a basket waiting in line. So the basket was the difference, the space between them and the other person. And so some stores have got it. They're doing it the right way, and it just needs to be more widespread. The other thing is that there's ways to distance the availability. Remember, we had a gas shortage, and you could only gas up your car if your license plate had started with a certain number or on certain days. That worked pretty well, and it's frustrating, but it worked pretty well.
It drove everybody crazy, but it did work. It did work. It required police, and it required a lot of government intervention.
The bottom line is this isn't done for fun or just, because somebody thinks it's a good idea. It's necessary.
Let me get to a couple more. One more question about the retail environment. I've got two questions. One from the retail employee point of view. I work at a local supermarket here. I see lots of people who come in showing sickness signs. My question is, we do sell open-air produce, deli-packed hot chicken, and lots of groceries. Can the virus stay on the products for a while? How long? Also, like our cash registers do. Sounds like a person that needs some reassurance, but is it there? Should there be? How are they doing it?
Well, from what I've heard, it's not really spread by food so much, so I wouldn't necessarily be as concerned about food as I would be about the surfaces that you're touching and then touching your face afterwards. But, I mean, the doctors might answer that one more effectively.
Right, it doesn't live, the virus can't survive too long, just a matter of hours on cardboard. So probably the shipments that you're receiving at your door are pretty safe. It stays longer lives longer on stainless steel surfaces, so they should certainly be wiped down with some regularity.
It's a good idea to remove when you get home, remove the outside packaging, your bag or whatnot, outside of your house. Dispose of it. And then don't touch your groceries right away for several hours unless something needs to go in the freezer or refrigerator. Wash your hands extremely well, because you were just out. And then when you go back to your groceries, bring them in and rinse them off and clean them before you put them away. Wouldn't you agree that that's a good way to do it?
Yeah, I think it's important for people to wash everything when they get it home and disinfect that. And there's some great videos on YouTube of doctors telling you how to do that. But
I got a good question for Colleen Momohara, a very specific question. What tips do you have for two parents working at home with a 16-month-old child? It's
yeah.
small.
First of all, your parent first, and I think this new normal, as we keep referring to it, is having to redefine what it means to be at home with children in this context, and the children's needs and their need to have parents interact with them and involve them in what's going on around them is critical. We are certainly concerned about all of the health needs, in this time, and that's very important. But we can't forget that children have emotional needs and social needs, and they need to have people there. And so, pretty much, it's almost in my mind when I think about what we know about children, is it's not that you're working from home so much is that you're in your home and you're a family first. And work will need to revolve around that.
You know, it's funny, I was just thinking about this, it's been a long time since I had a 16-month-old, but not so long for you. And it would seem that having two parents at home with a 16-month-old would be paradise for a 16-month-old.
Yeah.
You get all the attention you want,
Yeah.
and not a whole lot of instruction. It's just keeping you from burning your fingers. Okay, I got a lot of questions about masks. We've talked a lot about the social distancing and so on. Let me get to some of the mask questions. Dr. Blanchett, you wore a mask in here. One person said, why aren't you all wearing masks? Well, because we're apart. This is okay, right?
Well, we've gotten some mixed messages about it, because when you think of a cloth mask and you think of a virus particle being so tiny, it's going to sneak through the fabric. And so a lot of people thought, well, the mask isn't going to do much of anything. But the best answer I heard was from Dr. Fauci the other day on television, where he talked about the virus being attached to droplet particles that were larger. And even if you couldn't get a surgical mask or a N95 mask that is much better at protecting you, if you wear a cloth mask, sometimes with a liner inside, we're making them now with liners inside, and the other person or the other people you're around have masks, there's less of a chance of transmitting that virus. And so I think the new information about wearing masks is a good one.
Dr. Yamada, you have an opinion about that too?
Well, I would say that to me it's interesting that the party line is changing very rapidly.
That's right.
As the science develops and as we watch how other countries do it. And so we see that in many Asian countries that people wear masks and that it's not stigmatized, for one thing. So I think if we've switched over to everybody wearing masks, then we should all do it. I mean, that's going to be the responsible thing to do.
So it sounds like what you're saying. I've got several questions here. I'll just read them off to acknowledge them. What about homemade face masks? Should we use them? What materials? How to clean them? How to reuse them? All that stuff is online. It's pretty easy to find a DIY mask thing. HEPA filters, we talked about cutting up a vacuum cleaner bag that's a HEPA bag that can go between 2 layers of fabric, and it's probably not
The thing is,
bad,
you
right?
can't breathe through. One of the best things that protects against transmission through a cloth mask is vacuum cleaner bag filters. But then we tested it, you can't breathe through that, so you got to be able to breathe.
If a mask kills you, then it's kind of defeating the purpose. Yeah.
So all last week, I was working with some folks from the University Manoa who were working to design, if we had fabric masks and with filters between 2 layers of fabric, how would it best be put together? And so we were researching it online, and we found an article from Stanford Medicine that I think if you just Google Stanford Medicine masks, you'll find a pretty good article about different types of fabric that you can use for the mask and for filters. And we learned that tightly woven cotton is better for your mask itself, 2 layers. Then a filter between, there's also recommendations about what you might be able to use between those 2 layers of fabric. And right now we have a wonderful group of people at the theater group at the Manoa campus. They're wonderful seamstresses. They build these costumes, as part of their daily work, and they're not doing that right now. So we have them with some students who are working, like a sweatshop, I think, to produce masks for us and giving them to.
I don't mean to interrupt. There's a bunch of activities like that going on, all scattered around, all associated with different partners, and so. But for the average person who doesn't have connections, are we going to get to a place soon where there are enough masks for everyone? The mayor today said, "Oh, everybody should be wearing masks," but I mean, are we getting there? Is it
So were
okay
you
to
going to
make
get one,
yourself?
right? Well, you're right. We decided that the first places that we should provide masks for are the people like Dr. Yamada who are seeing patients in primary care, and their supply of masks may have run out, surgical masks or N95s, and they can't replenish them. If we're going to be making masks, let's give them to primary care providers like Dr. Yamada so that he and the staff that he works with and seeing patients that need to be seen will at least have that kind of a mask. So that's our priority.
Let me ask you, Doctor, are you having trouble getting enough equipment for your office?
Well, we're certainly running low, and we certainly would appreciate donations. I think in actual surgical masks and actual N95 masks is certainly what we need, and so masks sewn at home hopefully will be more for like the general public.
So probably people should go online, take a look at what they can put together themselves, and feel comfortable with that until products actually start getting back on the shelves. Is that what?
But the people that we're working with actually put a YouTube video together, and so if you Google that, you'll be able to find it, or YouTube search, you'll find pretty good instructions for how to put together a mask. Now, I don't know about you, but a lot of people don't sew, so it doesn't help, but maybe you know somebody who does. And
Okay. Well, maybe that's what we get Grandma to do when we can't visit her.
yeah, sure.
I think it's also important to keep in mind that just because we start wearing masks, that we can't forget about the social distancing. We must continue to work on that, and we have to pay attention to the vulnerable populations, people living in crowded settings, prisoners. I mean, look at what's happening on Rikers Island. We gotta let non-violent people out of jail. There's a difference between jail and prison, right? And so we gotta get people out of those very high-risk settings. And the other thing is that it's, you asked earlier, what are your frustrations? I think one of the other frustrations I have is I wonder who's going to pay for this, and who is going to pay for this? Who's going to pay for any of this for say, like the uninsured patients?
The money that is being thrown at this is unprecedented. I mean, the $2 trillion for the people who are getting laid off, another trillion at least or two to be spent on the medical side of it.
But a lot of that's going to bail out the corporations.
Well, they're going to be doing that too, right? Exactly. Let me ask a couple of technical questions. I'm trying to, like I expected, we got a lot of questions. Does that pneumonia vaccine help fend off the disease, doctors?
No.
Does it help fend off what?
Disease. Does pneumonia vaccine help fend off the disease?
No, but one of the things we know is that you hear it all the time, people with underlying illnesses who get the SARS-CoV-2 or COVID-19 disease, if they have something else wrong with them, they're much more susceptible to getting very sick. So what you want to do is protect yourself as well as possible against getting something else. And so getting that pneumococcal vaccine would be a very good idea if you haven't had it and if you're in a category that needs it. If the flu shot's still available and if you haven't had it yet, get your flu shot if you possibly can.
Well, let me ask though, so here's a question for Dr. Yamada. If you've taken the flu vaccine, will that minimize the COVID-19 virus? I mean, is there?
No. So, what I think what we've been saying up until recently is that if you test positive for flu, then you can stop because you probably have the flu. But now we've learned just within the past week or so that it's possible to have both. So Occam's razor doesn't apply anymore, and so we need to pay attention to that. So I was saying earlier about people worrying about how is this going to be paid for. I think this whole mess that we're in is a very good demonstration of the fault lines in our society and a very fundamental sickness that underlies our society. The fact that the profit motive underlies much of medicine. So I think if anything, this shows the need for us to work towards healthcare as a human right. We need to have as a first step Medicare for all.
Okay, Lord Zerbel from the Food Service Association. What's going to happen if too many stevedores and other supply chain workers get sick? Is that a worry? I mean, is that something we should be worried about?
It's a worry across I don't want to spark panic. I mean, it's a worry across the whole food chain right now. We have a lot of people that are afraid to come in to work at the grocery store or at the food distributor level. And, if we have way too many people call in sick, it's a problem.
But a lot of these organizations are hiring more people at the same time, right? People are willing to come to work for a decent job.
Yeah, so I think you're going to continue to see people trying to hire at the retail level because I do believe everyone is having staffing issues right now. I think you'll see the store hours shorten.
Colleen, one person is asking, do you have any tips for exercises for people living in condos or small places?
Dance with your kids, I would say. Put on music, dance, and move. That would be the most definite thing to do, especially if you have young kids.
Is there a playlist you have in mind? Or?
Probably the best thing is the things that, as parents or caregivers, the songs that we enjoy. Connecting with what we know or what we've experienced and sharing that with our kids is a very powerful thing.
Is it okay to let them have some more screen time than they would have otherwise?
There's so much issues around that. The younger the answer is no. And if it is going to be there, it really should be things that are going to spark the kind of learning that really sparks more conversations. It's like going to the movie. You want to go to a movie, and if it's a great movie, you're going to talk to your friends about it. But if you go to the movie or like being on screen time, and nothing happens as a result of that with people, then as a whole, it is not a good thing for kids.
Let me ask the last question to Patricia Blanchett. Are you confident in our ability to handle this as a state?
Yes. When we have people as dedicated and as passionate as our scientists working on this, we can do it. We can do it because we have to do it. One of the things I was thinking about when you were talking, Dr. Yamada, is about money. You know, a lot of people don't.
I got to stop.
Yeah,
I like the last line. We can do it.
we can do it.
Yeah. Thank you so much, all of you, and thank you for joining us tonight. And we thank our guests, Lauren Zerbel, Executive Director of the Hawaii Food Industry Association, Patricia Blanchett, geriatrics physician with the UH Medical School, Seiji Yamada, physician of family practice, and Colleen Momohara from the State Executive Office on Early Learning. Next week on Insights, another diverse panel of experts to help navigate these trying and uncertain times. Stay safe, stay healthy, and please join us then. I'm Daryl Huff for Insights on PBS Hawaii. Aloha.